Hi, everyone, and welcome back to the 9th annual CR Arthritis event at the Canadian Rheumatology Association Scientific Meeting, as well as the Arthritis Health Professions Association pre-course. Today, I'm joined by Ayesha, who has been a nurse clinician at the McGill University Health Center for almost 16 years. As well, Ayesha is a wife, a mother, a daughter, a sister, and a patient living with spondyloarthritis. So she gets to straddle both worlds. And with that, I just want to welcome you and thank you for being here to join us, Ayesha.
Thank you for having me, Ellen. Thank you for the invitation to share my patient journey. So it's a little bit nerve-wracking because, I've given presentations in the past, but I've given presentations as a healthcare professional. And so to have it flipped on me now, to give a testimony as a patient to, I'll call them colleagues of mine throughout Canada, and also globally, can be a little bit intimidating, but I'm hoping that my testimony will sort of open the ears and hearts of these allied healthcare workers in rheumatology, and hopefully can make some changes here and there if possible.
I think that's a great plan.
I think so too. I hope I can get the ball rolling with the help of some of my colleagues and co-patients.
And with that, we're going to get the interview rolling. I have a first question for you, Ayesha, is can you tell us a little bit more about yourself and how you're involved with the Canadian Spondyloarthritis Association?
Yeah, sure, definitely. So your introduction pretty much gave a summary of my titles. So I have been a nurse for almost 16 years. Inpatient oncology, hematology, stem cell transplant, and currently I've been working in the apheresis clinic. So there's a lot of work involved. It's highly specialized what I do. I'm also, like you mentioned, a wife, a mother to 2 young children under 10. So people can imagine how busy I might be. I also am a daughter. I've been helping out my family with some family members' healthcare issues. And so I have that title too. And then I'm also a sibling. So it's a lot to deal with, but with regards to the axial spondyloarthritis, I actually started having symptoms when I was quite young. I was 12, if I remember correctly, when I started having these sort of lower back pain aches. And I also had some GI symptoms along with it, but it was so infrequent that I didn't even bother telling my parents at the time. But when I was 16, I had my first major flare, which required me to go to the hospital. And I was followed by rheumatology for about 3 months. And so that's at the Montreal Children's Hospital here in Montreal. And so lots of investigation. They did see that my inflammatory markers were quite elevated. They saw that I had inflammation in the SI joints, the sacroiliac joints, so in your lower back. And but I was negative for the HLA-B27 antigen. So I was told that I didn't have any type of arthritis, that it was probably some sort of fluke, maybe, I don't know, maybe I was infected with something. They did find that I had a congenital defect on one of my lower vertebrae, and they suspected that that was sort of the cause of mechanical pain, and then it caused sort of inflammatory pain. I was put on medication, and after 3 months, I was sort of almost back to normal. And I was told at 17 that listen, you're going to be living with pain for the rest of your life. So you're going to have to give up a few things, and you're just going to have to accept that pain will be with you for the rest of your life. And when you're 17 and the world is supposed to be your oyster, and you're supposed to have years ahead of you to learn, to have fun, to experience things, and you're told that pain will be at the forefront, will be your best bud for the rest of your life, sort of discouraging. But at 17, I made the decision that, okay, well, the doctors are saying that I need to give up a few of my physical activities, and I just have to sort of live with the pain. And so that's what I did for years and years and years and years. And I only got my diagnosis of AHPA in 2020 at the age of 38. And I was shocked in the sense that I had been told all my life, even up until 2 months before I met this new rheumatologist, that I did not have any sort of arthritis, let alone axial spondyloarthritis. So I was quite shocked by the diagnosis. The physician, what was great about him is that he took the time to explain why I had it. So he, knew that I was a healthcare worker. He showed me my MRI and showed me on the imaging exactly why he was diagnosing me with AHPA. And, I brought up the HLA-B27 antigen. And he's like, no, now we know that 10% of people who have axial spondyloarthritis are actually negative for the gene. And so I asked him, not because I felt bitter in any way, but just if I presented to you now with the same symptoms that I had when I was 16, 17, how would you diagnose me? And he said, probably with axial spondyloarthritis. And I said, okay. And I was sad because there were so many things that I gave up over the years. Ambitions that I had because I felt that, I wouldn't be able to manage them with chronic pain. And then I just sort of like my healthcare worker hat came back on and said, okay, so what do we do? What are the next steps? And I went straight to biologics because I'll briefly say that I am followed at the pain clinic here in Montreal at a major university hospital center. And so I think I've been followed there close to 15 years. And so we tried everything from, NSAIDs, which I cannot take because I have ulcerative colitis, so inflammation of my intestines. So that was off the list. And then, anything from opiates to infiltrations, to codeine injections, to nerve ablations, to even lidocaine infusion to see if that could help with the pain. And nothing really helped. And so that's the reason why we decided together to go straight to biologics. So that's a little bit how I got diagnosed. And to answer your question about my involvement with the CSA, so actually when I was first diagnosed, after I called my husband to tell him the diagnosis, I called one of my very good friends and coworkers because her daughter also has axial spondyloarthritis, but a very, very severe form of it. So she's at the ankylosing state, so the fusion of her spine. And I said, listen, this is my diagnosis. I have an idea of where to look for information, but can you tell me anything that I might miss? And so she was more than happy to share, what virtual support groups were out there, what organizations were out there for people who have AHPA. She said you should go to the Canadian Spondyloarthritis Association website. There's a lot of good information there. She told me, what it would be like to be on a biologic, what steps are taken before you get to a biologic state. I did have obviously a knowledge of how that happens, but when you're looking at it at a patient point of view, you sometimes sort of forget, little steps. And she was there to remind me that like, I got this and that I knew where to look for information. And so that's how I stumbled upon, the CSA. I joined as a member right away, just to get information, just to see what was out there. And finally, I decided to join a support group because in 26 years of not having a diagnosis, I hid the fact that I was unwell. So I was really good at faking that I was okay. I think we see this a lot, we're really good at faking it, at faking being well when we're not. And I had absolutely no one to talk to. I mean, I mentioned to my parents I had pain. My husband understood that I have pain. My two young kids also, they understood that there was pain. Why do you have pain, mommy? You explain why. And but I never really had anybody who understood what I was going through. And so I was at a point of the diagnosis and a point in my life where I really needed support. And so I asked to be hooked up to a support group here in Montreal. And it was pretty quick. I think in November of 2020, I asked for a group. And then a few days later, I was hooked up to a group. So they've been a really great support over the last, it's going to be 3 years in August that I have the diagnosis. And it's like, it was sort of liberating because you feel isolated and alone when you have this disease. And for someone who didn't even have a diagnosis for 26 years, it's incredibly sad, because you lose things over the years, you lose opportunities, you have to give up things. And one of the things that the support group helped me with is actually this feeling of loneliness. I didn't feel so alone anymore. And people got what I was saying, you know, when I was describing the pain that I was having, and like, oh yeah, I get that too, or yeah, that happened in my last flare. And I'm also for patient advocacy. So, you know, the nurses hat comes back on again, and in the support group, you know, I met virtually and some people who were unaware that certain services existed for us or patients in general. And so, you know, I was able to recommend certain programs to patients, how to get in touch with a doctor easily. For example, you know, there was a woman in my group who actually has the same rheumatologist as me, and she had said, oh, I'm having a really hard time reaching him. And I said, well, why don't you call the infirmière pivot, which is what we call them, so a pivot nurse. So they're a nurse who's specialized in rheumatology, who helps the doctor. And so she was like, what? Someone like that exists? And, you know, the reason why I knew is because I asked the question when I got into the clinic, and I said, is there a infirmière pivot, pivot nurse? And I was told yes. So I said, okay. So she didn't even know. And we were in the same clinic with the same rheumatologist, and she had no clue. So to be able to share that with her so that she had a resource when she had a flare, you know, it made me feel like I was getting something done. And I think that's what some of the group members saw. So Dr. Eli Karam was in the support group, and now he is chair of the board. And he contacted me in September of last year and said, hey, you know, we'd like to start this new initiative of, it's called the Patient Partner Program. And we like to link up patients who are experienced with the disease and experienced with the journey, and link them to patients who are newly diagnosed. So, you know, coaching them on what resources are available, helping them prepare for their appointments, just providing them support and recommending a support group if that's what they need. So that's my involvement with the CSA. So it started off as a patient of AHPA looking for resources, and it's slowly turning into being a patient partner leader when I have the opportunity to do so. So it's kind of full circle right now. Yeah.
You know, absolutely incredible. And there's two things that really did resonate with me. The first being, like you said, you can be a patient and have the most loving family and the greatest friends, and they are the most empathetic people, like so empathetic, but because they have they can't even conceptualize what it's like to live with inflammatory arthritis. It's really hard for them to connect, not because they don't want to connect with you, not because they don't want to provide the support, but having other patients in your network who like you said, they really get it. Like you don't have to say anymore. They get it. The way that they look at you, the way that they nod their head, like they get it. And the second thing being your message, I think, or the undertone of that message of like, how many things are around us that we don't know about? How many resources don't patients know about, right? Like, how many different diverging pathways could we have taken to get better care, whether that's self-advocating or knowing of one, for example, one educational training online program that would have given you information that you could have changed your health outcomes. Like how much out there that we're just not leveraging. And such a powerful story. So I want to say, like, thank you for opening up and allowing us to be here on your journey.
You're welcome. It's like I said in the beginning, it's sort of almost intimidating, you know, having to share. Well, not having, I was asked to share, and I was more than happy to share the story. But to share as a patient, as opposed to like giving a, you know, presentation with all my research and whatnot, it's different, right? Because it's subjective. It's, you know, I don't have statistics which is what we usually look at, right? In healthcare, we look at statistics and probabilities and the likelihood of such and such a thing. That's not what my presentation or interview is about. It's actually the patient perspective. And so I think by sharing my story, my hope is that it'll open up their ears a little bit and say, hey, you know, how did this person slip through the cracks for 26 years? Because already, as we know, since, you know, you're a patient as well, it takes, you know, about, depending on which, you know, studies you're looking at, 7 to 9, 7 to 10 years to get a diagnosis. And that's men usually. Women were on the upper end of that limit. And then if you're HLA-B27 negative, and if, you know, you have clinicians who are focused very much on that, you know, your diagnosis will take a much longer time to arrive. And so, like I said, I'm not bitter by having this diagnosis, you know, come after so many years. I'm actually sort of relieved. It's, you know, maybe you can understand it's like not in your head. People will take you more seriously for having back pain. You know, when you say, I have an autoimmune disease and it's inflammatory arthritis. Oh, wow, that sounds really painful, you know, and like healthcare workers listening, you know, when you go in for your appointment and you're listing out all your, you know, health history, and then, oh yeah, I have axial spondyloarthritis. You feel that much more, I guess, justified, you know, in sharing what you're going through. You don't minimize the pain anymore. So this is something that I found was liberating about getting the diagnosis. I mean, it is still quite scary because, you know, there is no cure. You know, medications and treatments are there to help lower the inflammation so that the disease did not progress, you know. So yeah, no, it's been quite a whirlwind in the last, you know, 2 years since getting the diagnosis.
I can completely understand allowing a label to be there. I know, as silly as it sounds, is an acknowledgement, and it's somebody saying that, yeah, your pain is real and you've been screaming here for like multiple years, like, my pain is real, but nobody took you seriously, and finally people take it seriously, and it's like, I just feel, like you said, justified. And it's the silliest thing because it's not like my pain actually changed, but it's like relationship to the disease, because I now have a label that is.
Like you said, like, you know, in this day and age, we don't want to label things, you know, it's not PC, or we don't want to associate a label to anyone. But in this case, like you said, it's funny that this label is now justification for us, you know. It is silly, but, you know, if you think of the pain, right, you have the McGill pain index, and ankylosing spondylitis or you know, axial spondyloarthritis is really, really high up there. So, you know, when people ask, like, how bad can the pain get, you know, sometimes I feel like pulling up the index and saying, you see here, that's where it is. When you compare, like, you know, giving birth or like an accident or whatnot, it's like high up there, right? So like I said, it's like a justification for all the years that, you know, people were denying the pain or labeling it as something that it was, because, you know, I was labeled at some point in my 20s when I went to a pain clinic. And while I was getting dressed, the person who accompanied me to the appointment was still in the room with the physician, and I believe was a resident at the time, and basically just said, oh, it's just women issues. And I only found out after I had left the hospital, when the person told me, oh, hey, by the way, that's what the doctor said. That's what he thinks. I was devastated. You know, I asked myself, is the pain really that bad? You know, did I really have to go to the pain clinic for it? You know, so I started minimizing what I had. I was later, you know, resent to the pain clinic because I was not managing the pain well. And I was fortunate enough to get a physician who really listened to what I had to say and was sort of horrified that, you know, previously somebody had said that. But it was a great feeling also to get acknowledgement that, hey, you know, we know that your pain is there. We don't know what it is, but we know that it's there. And so, you know, I've kept a really good relationship with my healthcare professionals who've been, you know, looking out for me for the past 15 plus years and they've helped me a lot. So even without the diagnosis or the label, as we call it, I got a lot of good support from my clinicians there.
And it's just one of those things. You're like, why do people not go to healthcare appointments to take medications? Or it's because they experience these like traumatic.
Yeah, I mean, misconceptions, right? And when something is minimized, whether it's axial spondyloarthritis or any other sort of symptoms that you have, when it's minimized by someone in healthcare, and you know, I work in healthcare too, so I'm hoping that I don't think I've ever done that, just because, you know, I have other autoimmune diseases as well, so I know what it's like living with illness, you know, and chronic illness, and that influenced my practice as well. But you know, this is why these sort of gaps in knowledge happen, because either there's a misconception, either there's no, you know, recognition of the signs and symptoms that somebody's having. But you know, this is why there's certain gaps in patient knowledge, especially, you know, when you feel like the person who's supposed to help diagnose what you have, whatever it is not listening to you, or you feel you're not being listened to. You know, discouragement creeps its way in there. And so that's why a lot of, like you said, a lot of people, they don't trust the healthcare system, or they won't go back to the healthcare system. And then what happens is that it gets overloaded later on, right? Because then they have a flare, for example, they end up in emergency when it could have been prevented. And so I think a lot of patients do feel this sort of like bitterness, or they feel unheard. But at the same time too, you know, this perspective of the healthcare worker, because, you know, I've been in the field for quite some time, we don't get to see our patients as long as we have to, or as long as we need to, you know, depending on their diagnosis. So there's that time limit, and you're trying to get everything in a short amount of time, you know, that you're assigned to this person. That also, you know, causes gaps. There's also, you know, I mean, healthcare, there's gaps right now. We're not going to fix it. I mean, everywhere in Canada, I can speak specifically to Quebec or Montreal. You know, these gaps exist everywhere, and we know that there's no easy fix, right? We know that there needs to be money that's put into the system. We know that we need to hire people into the system, but until then, you know, these gaps still exist, and it doesn't mean that we can't try to close them while we're waiting for things to get better. You know, even just like having a resource like the Arthritis Broadcast Network, or the Canadian Spondyloarthritis Association, or knowing that there are support groups available. I mean, these are the small things that can sort of close off certain gaps. And that way, patients don't necessarily fall through the cracks, because they know that there are services or resources available to them. So that's a big thing, a big innovation sort of that we can do. It's not perfect, but if we can sort of check off these gaps here and there, it'll be that much more better for healthcare workers, but also for their patients. If we're able to share these resources with our patients and say, oh, you know, whether you have the extra 30 seconds to say, by the way, there are a lot of associations available to you. If you go in the waiting room, you'll see a list, you know, something like that. Or even just, you know, patients on the other end too, understanding that the doctor would love to spend more time with you and listen to everything, but you have to be very concise, and you have to know, you know, the most important symptoms. What is distressing you the most? You need to say that first. You need to go to that appointment knowing what you want to say. And if that means that you have to note it down, or even like, for example, on the CSA website, there's actually a checklist, an appointment checklist that you can bring physically to your appointment or virtually if you're meeting with your physician that way or some other clinician. These things kind of help. It helps you tie in what you need to say in that short amount of time. Because I think sometimes patients, when you're not exposed to the healthcare system or you've been well for most of your life and you've never had to reach out or be a patient in the healthcare system, you get there and then tuck, 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 and then 5 minutes later it's done, you're out of there. It's very overwhelming. Like, did I hear right? What did the doctor say about that again? Or what did my nurse say? If you have that list, it sort of makes everything more concise. So, I mean, these are like really small things in my mind that can sort of help physicians, allied healthcare workers, but it also can help the patient as well.
So well said. And I was just having this thought as well, Ayesha, where, the theme of this year's conference is renew, reconnect, and reimagine. And these are big words, and we're thinking of innovation, where innovation doesn't have to be, invent the next cure of something. Innovation can be small, and small is still meaningful, right?
Right.
These things like, if you're an allied health professional, know your resources, know where to point people. You don't have to explain and walk through the brochure with them, but have them in your office, have posters, have that connected with the admin staff. So in case there needs to be an exchange of information, but from a patient side, also know that there are limitations within time and resources. So to be prepared for your appointments, right? To have all of your documents with you, ready to speak to them. I think that's like such a balanced answer. And yeah, it really makes you think like, wow, these are so actionable. These are not unreasonable to implement at all. I have no excuses not to do this.
Yeah, because then you're putting the onus is not just on the healthcare worker or just on the patient, right? What you're doing is you're sharing responsibility. And, like I'm 16 years in the healthcare system, and I can still remember when I started, the patient, like they always say, the patient is at the center, and then you have all these resources around. I always tell my patients, when they come in and they're scared of not being heard, that like we're a team. We're a team with you. Like we're on your team, right? We're not there to talk at you. We're there to take care of you. We're there to answer your questions. But at the same time, too, by saying that the patient is on this team, right? You put that responsibility on yourself, and you need to advocate for yourself. A lot of people have, old school thinking, or just, because they're not familiar with the healthcare system, that the responsibility goes to the healthcare professional, that you sort of wipe your hands clean. And they will tell you what you have. They will tell you what you need. They will tell you what you need to do, where you have to go. But in reality, yeah, sure, they give you a diagnosis. They tell you what the plan of treatment is. And that's what they can do for you, which is a step. It's the first step when you get your diagnosis, right? But, when you're on this team, the U team, you learn how to become more of an advocate for yourself. And I'm very, very, very passionate about, patient advocacy, self-advocacy. I always try to teach my patients, how to go about being an advocate for themselves, because you can't, rely on someone else to do things for you, right? I mean, even in everyday life, like I can't just rely on my husband to do everything, right? Like it's not only his responsibility, I have responsibility as well. Or like, you can't just rely on someone on taking care of something. I mean, I'm speaking very general. In other, specific situations, yes, you need to rely on somebody, but I'm just, generalizing it right now. We have to be advocates for ourselves. And the way to do that is basically knowing what resources are available, knowing how to ask direct questions, knowing what to listen for, and not being scared to say, wait a second, I don't really understand that. Can you explain it to me again? Not just pretending like the appointment went well and then get out of there and then realize that, 80% of what was said, 90% of what was said sort of went out went in the ear and then out the other, not because you weren't listening, not because you didn't want to, but because, like you said, a lot of big words are said, a lot of treatments are said. And sometimes as healthcare professionals, we forget that we need to talk more in layman's terms, as opposed to having like these big words to things. And so I think, like I said, it goes both ways. And I see it both ways because I work in healthcare and I am a patient as well in healthcare. So yeah, no, like you said, it's these small little things that can help. You don't always have to take these large steps to do things. It can be small steps. They'll still get you to the same place. It's just that it might take you a little bit longer. And that's okay, because we know that there are gaps right now. And I think we just have to understand that, it's no fault of our own as patients and no fault of the individuals who work in healthcare. We're sort of stuck with what we have right now. And I think if we all speak out and say, hey, this is what we need, this is what our patients need, then the more people that are aware of these missing items, the better chance we have at sort of filling them in. Small steps do make a difference as well. It doesn't have to be the big giant steps. We don't have to bring in the big guns. We can just, take those small steps together, which is the important thing.
Yes, that's the key right there. Thank you, Ayesha, for really sharing such an important dialogue that I don't think we've ever had, on this program. So I do want to thank you for being candid, for your time, for your honesty, and really for your lens. You're really balanced, right? I think you bring such a unique lens to this. So with that, from everyone who's watching, a huge thank you.
Oh, you're welcome. Thank you for having me. It was a real great pleasure.
And we are excited to see your presentation at the AHPA pre-course. So looking forward to that.
And I'm looking forward to giving my testimony and sharing my journey.
And with that, everyone, we hope you join us for our next episode of CR Arthritis, and take care. Bye.
Bye.